every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
As we dive into today's topic, let's talk about a disease that has been plaguing Nigeria for way too long: malaria. This mosquito-borne illness has affected millions and is still affecting individuals across different age groups. It's important that we understand its impact and explore effective solutions. Today, we'll be uncovering the challenges and opportunities in tackling malaria in Nigeria. Malaria is indeed a significant public health problem with an estimated 263 million cases and 597,000 deaths due to the disease in 2023 in Nigeria. Nigeria has the highest burden of malaria globally, accounting for nearly 46% of the global malaria deaths. It is the leading cause of death, particularly among children under 5, and accounts for a large percentage of the world's malaria cases and deaths. The risk of transmission persists throughout the country year-round. We'll be discussing malaria, the most significant public health problem in Nigeria, with our expert today on your favorite health TV talk show, The Physicians. It's another beautiful day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and today we are talking on something very important that affects all of us: malaria, the most significant public health problem in Nigeria. And of course, to give it light, to shine that torchlight, to nip it on board, to make it resonate with each and every one of us, for us to go away with something that today that you listen and watch us on The Physicians, and that person to talk about malaria is no other person than Dr. ALERO Roberts, who is a consultant public health physician and an associate prof, College of Medicine, University of Lagos. I'm always in tune to call you Prof. I don't know what's always holding. You know, I get it, but you're welcome on board.
Thank you so much, and thank you. Don't worry, the time is coming.
The time is coming. Joy is coming. You know, that joy. We need to go for that and the inaugural lecture. Absolutely. And everything that comes with
Absolutely.
it. And eat our Niger jollof rice on top of it. Now we're talking about malaria. We've talked about this every time, practically almost in every quarter. There's always the topic related to malaria. And we know how bad malaria can be, but we also, on this flip side, take it for granted, because somebody says I'm having body aches, but it's not just malaria, but malaria is killing people every day.
You're right.
It's affecting like there's no household you go to that you won't find somebody who is currently having malaria, who has just treated malaria, who is about to have malaria. Now, what are the main challenges, like, in controlling and preventing malaria? Because we're talking about malaria as the most significant public health problem in Nigeria. So what are the challenges in controlling and preventing?
You're right, Dr. Memuna. It's it's a topic that you think, what more are they going to tell us about malaria? We've talked about this thing 3, 4, 5, 6, 10 times in a year. But I think the part of it that for me has now become the major challenge in terms of controlling and preventing. I mean, we define the highest number of cases globally.
You're right.
By sheer numbers. We have the target to eliminate it, eradicate it by all means possible. So why is it still a major challenge? Let me give you the shocker of life.
Okay.
Drug resistance and treatment failure.
Oh. Drug resistance and
yes,
treatment failure. That means what we've been using to treat for is no longer working.
Yes. We're beginning to see rising cases of resistance to artemisinin combination therapy, to artemisinin. It's coming in from the far from the far east. And we're beginning to see cases of it in Nigeria because, again, you know, at the individual level, we take it all for granted.
Yeah.
Is it not just malaria?
It's not just malaria.
And we take like 1 or 2 tablets.
I don't like that statement. Don't just say it's just malaria.
There's nothing just about
malaria.
There is absolutely nothing just about malaria. Because when we are sitting there in the hospital, in the accidents and emergency, and they are bringing in fully grown adults, and malaria is taking them out, we are wheeling them to mortuary. That's when you know that there's nothing just about malaria.
But how can communities be empowered?
Knowledge.
Because I always go back to because we're all part of a community.
We're all part of a community. Yeah. It is this exactly what you are doing now. It is knowledge. If people will understand that there is nothing just about malaria and will take each episode of fever seriously and get it checked out. Because the one thing that happens is that number one, malaria is being misdiagnosed. What you have may not be malaria.
And you just assume
you're just assuming malaria, and you go and take 1 or 2 tablets of some anti-malarial of questionable efficacy.
Without even doing tests. You know, sometimes people will come to you, Dr. May, I have malaria. I say, okay, what do you want me to tell you?
Exactly.
Because if I didn't make the diagnosis.
On what basis?
Oh, they're telling me so. I said, don't you, no, we should do this. No, this is how I know it. Anytime I have malaria, this is how it presents. I'm not cancelling that out, but can we look at it differently? Because not all fever.
Every single fever will give you body aches and pains. That pain in the low back. That's painful itching of the skin,
and you want
scratching of the eye, bitter taste at the back of the throat, very deeply concentrated urine. Every single fever will cause you that, including malaria.
So don't assume it's malaria.
So, I mean, unless you've gone to medical school, I don't know. In fact, even as doctors and nurses, we know now, test every fever. Yeah. If it's malaria, we know what to do. The worst one is when it is not malaria and we are not treating it right. That misdiagnosis. Because even when we are treating malaria, the drugs we're going to use, the dose, the length of time we're going to use it for, they are all specified. And that's what people don't take importance.
So when we talk about resistance, the people that also start and don't finish, do they also
contribute to the resistance?
Because they will talk for a day and say, oh, I feel better.
I feel better, and then they stop. And the parasite is getting used to the drug. It's getting used to the drug. So the next generation of parasites has taken that drug on board in its makeup and is now used to the drug. So the drug no longer works for it. That's how we are beginning to see drug resistance creeping.
So what resources do all the people that are listening to us, watching us now, what resources do you think every household, every family needs to prevent mosquito bites and malaria?
First of all, that is the most important thing. Don't let mosquitoes bite you.
But you must go out now.
Yes, now. Use an insecticide.
It's expensive.
Oh.
I'm speaking for my people.
And so treating malaria in the hospital is cheaper, Abi.
So
prevention is always still going to be better than cure.
So apart from the mosquito repeller,
you use the mosquito repeller. Use insecticide treated nets. Make sure mosquitoes don't breed in your area. If you see some of the I don't want to advertise for anybody, but if you see some of the strategies I've used in my house that have massively reduced mosquito population, because once there are no mosquitoes and they don't bite you, you're not likely to get malaria. And that also goes for even that's another day's discussion. Sandflies and the diseases that they carry as well. So we've got to reduce. If you where appropriate clothing.
Okay.
To make sure that, you know, mosquitoes don't get to you, particularly for children.
But with this heat now,
Yes.
I would not cover ourselves when this heat.
No, the heat is even better. The rainy season is coming.
It's coming.
That's why we are now going to see a resurgence of malaria cases, particularly in the south and southwest, where there's, you know,
swampy areas.
Yes, where there are swampy areas and whatnot. So we really have to make all efforts to make sure that we are not being bitten by mosquitoes. Indoor residual spraying. We should find out more about it. But honestly, just the use of the insecticide treated net. What I tell people, even without you sleeping under it, use it as curtain.
Curtain, yeah.
Because just having it up means that
so people use they see it as decoration.
Yes, use it as decoration. I don't mind. Use it to cover the doors and the windows. Even if you say, oh, I am too hot, I can't sleep under it, no problem. Is it up? Because the insecticide prevents the mosquitoes from coming near you.
Especially if you have children that are under 5.
Especially if you have children that are under 5.
So when we say malaria is the most significant public health problem in Nigeria, what does that mean to the common man in the public?
Number one, it means you get sick, days off work. While you are sick, somebody is at home to stay off you. That's another person off work. While you're off work, you're not generating income for yourself, for your family, for the nation. That is time off work. The cost of treating it, that's what we call direct cost of treatment. All the other ones are indirect cost of treatment. Then you have the direct cost of treatment. All these things add up little by little by little. Now, the reason why people don't take the full cost of anti-malaria is very simple.
Cost.
Wow. It's expensive.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. We have been talking about malaria, the most significant public health problem in Nigeria. And you and I, we agree that malaria is one of our biggest problems. Sometimes we are hungry, we think it's malaria. Sometimes we need to rest, and because we have not rested, we think it's malaria. Everything is malaria. You want to lie, it is malaria. We get you. But now we are telling you that it is the most significant public health problem, because when you have malaria, you will not be able to walk, you lose time, resources, the cost of treating malaria, the manpower you lose, because when you don't have money, your family also may suffer, the nation will also suffer. So there's a direct cost and of course several indirect costs. And with our expert in the studio, she has also re-emphasized the fact that not all fever is malaria. If you have fever, do yourself and your family and us, family and friends, the nation, good by visiting that primary healthcare physician just to eliminate malaria. If it is not malaria, it can be something else. Because once you have fever, all the symptoms you have for malaria, you also have it, and it may not just be malaria. Dr. Laura Roberts, thank you so much for shedding light on this very important topic and listing and highlighting why it is the most significant public health problem in Nigeria. Now let's go to effective strategies and management on how we can reduce the death, especially on under 5. So can you discuss the impact of hygiene in environment and how we can take care of malaria?
Definitely, because environmental hygiene is one of the known strategies for reducing, and that's what I was talking about when I say if you see some of the fantastic strategies I had to put in place.
Maybe you should even break down some, look for a way to break it down for us.
I would love the experts to come up, but there are certain plants, for example, that if you plant them around your house, I wish I knew the botanical names, I don't, but like the snake plant, and neem, the dogon yarrow, the neem tree, are natural, and they reduce the population of mosquitoes around the house. But keeping the house, the surroundings clean and tidy and free from swampy areas, from stagnant water is also very important.
We hold this country.
Yes,
we go to the market, we nylon, we bring it.
Yes.
Tomorrow I will need it, you will keep it. Plastic from we'll keep all that
plastic. In fact, I have to give Lagos State kudos for eliminating, for really clamping down on the amount of plastic waste, because all those plastics gather water that now mosquitoes can breed in. The rainy season is coming, and they have already warned us. That issue of global climate change.
Exactly. I need you to
that issue of global climate change is very, very pertinent, because malaria is known to be one of the most climate sensitive diseases in the world. Malaria and dengue fever are two of the most climate sensitive diseases in the world. So areas where we are seeing climate increased global warming, climate change, increased risk of flooding. Yes, we are going to see an increased risk of malaria transmission.
So Nigerians should be concerned about climate change issues.
Very,
because
very
when we are talking
concerned
about it, people are like, no, this is an important now.
It's not our business. Anything. It is our business, particularly those of us along the coasts of the West African coast, because the sea levels are rising. We are beginning to lose the swamp, the brackish areas that kept this mosquito transmission lower. We are now seeing higher risk of freshwater, swampy areas where the mosquito breeding it can increase.
Wow.
And all this is, and you have to add to it the internal migration, internally displaced persons. So there's overcrowding. There are more people who are coming in, living in unregistered slum areas that are growing. All this adds to the transmission of malaria, and you cannot live in an ivory tower forever.
You can't.
You will come out and go to market.
You will go out. You visit people.
And all this is going to affect us one way and another.
So what are the innovative approaches in eliminating and controlling?
There's nothing innovative about the approach. Education is number one. People must be aware. Number two, not all fevers are malaria. Please, when you have a fever, visit the primary health care center. Get properly assessed. Let them test you. Let us treat you properly. Number three, when you're given your drugs, finish them according to the dose. It's a bit complicated. It is difficult. Yes, we know, but it saves life. It saves life. Pregnant women, children under 5, sleep under an insecticide-treated net.
Wait, I'm an adult. What about me?
Sleep under an insecticide-treated net.
Okay.
But if you cannot, because you say you are now that age where the heat is getting, use it as a curtain.
Okay.
Use it as a window blind. Use it as a door blind. Use it as a curtain so that it is spread out up there.
Yeah.
So that at least the insecticide is perfuming the atmosphere and preventing mosquitoes from.
A question that just came into my mind is good before we go. What about this blood group and malaria?
Oh yes, certain blood groups are more at risk than others. So, but because we live in an endemic society, malaria zone, it's an equal opportunity bad belly disease for all of us.
So all this AA
doesn't protect you.
So we should not be rejoicing.
Don't think that because you are a certain blood group that you will not get it.
And I'll be rejoicing.
Don't be rejoicing.
So it affects all of
us. Everybody.
Because we're sub-Saharan Africa.
We're in a malaria endemic zone. So Nigeria is don't. We're not like Western Kenya. We are in a malaria endemic zone. We are subject to climate change. We are subject to internal displacement of our people, conflict. We are subject to the breakdown of our of law and order from certain areas. So please, don't think that you are somehow exempt from this. We are not. None of us are.
So my happiness has been cut short.
Sorry. I'm very sorry. But if it will cause you to take on board some of these preventive measures and making sure mosquitoes don't come near you, I I give people, there's a certain insecticide cream. Okay. And I said, put it into your
body cream and be using
it.
Okay. Okay.
Yes.
That sounds good.
Yes, when I go out, I just rub a little on my arms and on my forehead so that they don't come around me at all. Prevent mosquitoes from biting you. Plus, if mosquitoes don't bite you, you have much nicer skin.
Exactly. So what is the role of the family when it comes to, in helping to prevent? Because we do know that there's a huge impact when somebody has malaria. But what is also on the other side, the role of the family in prevention and elimination when it comes to?
In helping, definitely in keeping the environment clean, the inside of the home clean, all these things are part of what the family, and the family should, family members should encourage family members to do the right thing. I know if, we've done these studies before, if the baby in the house is ill, everybody's running around, and everybody's running around. When the mommy of the house is ill, she tends to downplay.
You're right.
No, don't.
Don't, right?
Don't. Family members, don't let mommy downplay her symptoms. Don't let daddy say it is just malaria. No.
Okay.
Daddy too. If daddy is not feeling well and is not,
shaky
please, he must, men don't like to go to health center all the time. They feel that I'm a man now, I can chest it.
No, please go
to malaria. Go.
So what are your last words for Nigerians? Because we are taking malaria from the angle that is the most significant public health problem now in Nigeria. What is that message to Nigerians?
I think the most important message I want to give to Nigerians is that the biggest challenge we are facing in this country concerning the prevention, control, eradication, and elimination of malaria is treatment failure and drug resistance. These are individual issues. As an individual, you need to take control. You need to prevent mosquitoes from biting you, and if you feel you are not well, you have a fever, please have it properly clinically assessed and properly clinically treated. If you are given an anti-malarial, take the full dose for the complete duration of time. Don't just stop simply because you feel better.
Awesome. That just wrapped up everything. I don't need to add anything. I'm just letting you know malaria kills people every day. Don't be part of the statistics. And please be free to follow us on all our various social media platforms. And if you want to be part of this show, just go to our website, fill the form, and you'll be right here. You can binge on our YouTube page for over 300 episodes we have right there for you. My name still remains Dr. Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.